A 75-year-old man with hypertension, type 2 diabetes, comes in with headache, nausea, vertigo, hoarseness that started 1 hour ago. Exam shows decreased pain and temperature sensation on the right side of the face, the left upper and lower extremities, and right-sided ptosis is also noted. What artery has been affected? A. Anterior communicating artery. B. Anterior inferior cerebellar artery. C. Posterior cerebral artery. And D. Posterior inferior cerebellar artery. So try to figure out this question, and then I'll explain in 5 seconds. Okay, so the answer is going to be D, posterior inferior cerebellar artery. And so this is Pica syndrome, so essentially lateral medullary syndrome. So this is when you have a Pica infarct, and so this is going to affect multiple nuclei. So it affects the nucleus ambiguus, the spinal trigeminal tract, and the vestibular nuclei. So each of these correlates with the presentation that you're going to see. So we'll break this down one nucleus at a time. So we have the nucleus ambiguus. So essentially this one gives the motor fibers to the vagus and glossopharyngeal nerves. Now if you have impairment of these two nerves, so cranial nerve 9 and cranial nerve 10, you're going to get dysphagia, right? Because 9 is responsible for swallowing. And so if you have impairment of that through this syndrome, then you're going to get problems with swallowing. And same thing with 10. 10 also aids in swallowing. And so moving on to the spinal trigeminal tract, we're going to have ipsilateral loss of pain and temperature on the face. Remember, the sensation of pain and temperature for the face and the body are two separate systems. So the face is going to be controlled by the spinal trigeminal tract, whereas the body is going to be controlled by the anterolateral system. So you're going to get a contralateral loss of pain and temperature sensation on the upper and lower extremities if you have damage to this. And then finally, we have the vestibular nuclei. So this is why a patient can have vertigo or vomiting, because you also have impairment of this when you have an infarct in the pica. And so finally, we have the sympathetic fibers being impacted, and so that's going to cause the ptosis on the one side. And so ptosis, if you recall, is just drooping of one side or the eyelid. And so the other answer choices are going to be anterior communicating artery. And so for this one, you can have aneurysms and they can compress nearby cranial nerves, but it's more likely to cause visual impairment and wouldn't cause all the other symptoms that we see for this patient. And the other one is going to be the anterior inferior cerebellar artery. And so this causes lateral pontine syndrome. So this is where the facial nucleus is impacted and you're going to get facial droop. So we did have that in this patient. We had the ptosis, but we don't have the rest. We don't have the decreased salivation, we don't have the decreased lacrimation, or the decreased taste sensation. So if you see all of this, think more about lateral pontine syndrome. And then finally, we have the posterior cerebral artery. If you have a impairment in that, it's going to cause contralateral heminopia. So it's essentially on one side, you have half the vision gone. And so this is because the posterior cerebral artery is responsible for blood flow to the occipital portion of the cerebrum. So therefore, your vision is going to be impacted if you have a infarct in this area. So for this question, it's a little bit tricky since lateral medullary syndrome has multiple components. But if you see a bunch of different symptoms like this patient does, just have this in your differential, and then to confirm it, you have the vertigo because it's correlating with the vestibular nuclei, and you have the ptosis and the right side of the face and the left upper and lower extremities. So I think this is the part that really helps me out, is noticing that the right side of the face is impacted and then the left so the ipsilateral and the contralateral extremities are impacted, really clues you in that it's going to be D. So I hope that helped, and thanks for watching.